An organization that respects female doctors, registered with the Medical and Dental Council of Nigeria, MDCN, is in partnership with the Federal Ministry of Health on self-care for sexual, reproductive, and maternal health. The organization is the Medical Women Association of Nigeria in conjunction with Pathfinder International, a non-governmental organization that partners local government communities and health systems in developing countries to ensure that people all over the world, wherever they live, have access and rights to sexual and reproductive health services. Dr. Amina Dorail, the country director, Pathfinder International, was represented by Sekina Aminu Bello. In a chat with journalists, she spoke on the partnership.
Pathfinder's mission is to, continuously collaborate with partners, identify new voices, and Medical Women's Association is one of these new voices that we have identified as a critical partner in ensuring universal health coverage and expansion of access to sexual and reproductive health services for women and girls across Nigeria. So we see this partnership really as something that will go a long way in fast tracking the progress, not just for self care in this instance, but for sexual and reproductive health in general. This association cuts across all the states of the country. So there's no stronger, group than this. And they are women, they are mothers, and they are health professionals. So it is part of their core mandate. And then also as mothers, um, once they take this and they lead the advocacy, there's no bounds to where it can get. And because they are respected also in the communities, so even in cases where there is a bit of myths and misconceptions, who best to dispel these myths and misconceptions, and gain the trust of the communities?
We are here on orientation and awareness on the self-care guideline, which has been prepared by the Federal Ministry of Health with other stakeholders in the important field of reproductive health, maternal health, and child health. Pathfinder has been driving this process. We've been discussing with them over the last few months in how we can increase the awareness and also organize this orientation session for our members who are spread all over the country and who we believe that we will be able to carry these messages to the crannies of all parts of this country. Not only will we organize training of trainers sessions, we'll also organize regional meetings so that members in every sector, obstetricians, public health physicians, family physicians, consultants, residents, even medical students, they can carry these messages, and we will be hopefully we'll be able to help our people access care at every level. Traditional medicine is often unexplored, but there are things, for example, people are talking about the use of ginger to reduce nausea in pregnancy. That is part of it. There are things that our people have always done. So we just all need to sit down and see how we can access those aspects of it.
The session discussed the country's process in adapting self-care and provide an overview of the contents of the Natural Self-Care Guidelines (NSG).